Again, it gives me immense pleasure to say that another institute who's doing a wonderful job in Peshawar, Peshawar Institute of Cardiology, has also started stroke program. So Dr. Ali Raza is going to give us the details.
Thank you so much for inviting us today, and we are just in the start of our stroke program, and I would like to thank Dr. Asim Javed even before I start my presentation because of the immense dedication he has shown towards the stroke. And I'm surprised he's available at 2 a.m., 3 a.m., 4 a.m., anytime you call him. I don't know what time does he sleep actually. So that's our center. It's a dedicated actually cardiology center. So, okay, so I'm going to start with our case that why did we start it. We've got a lot of volume of cardiology as procedures to be done, and usually you know that you will get stroke here and there, and then in the beginning what we were doing is that if we had any stroke complications, we used to talk to the RIC and shift the patient there, but that what it does that it loses the initial beneficial time in which you can treat the patient. So we decided that we will take on this service and probably produce it, some service within our center so we can facilitate these patients. And we do a lot of structural work as well, so in that we can have issues as well, so we thought that at least we should have this service available at our center. We are actually next door to HMC, so I think HMC will always take the lead on the stroke than us, and we will probably follow them. So this is a gentleman who was 69 years old, presented to our emergency department for chest pain and STEMI. He had his usual treatment for the cardiology basis, and then he was shifted to CCU. And there he developed this weakness of his right side. Now, this is an initial examination and which we performed, and as soon as we got this, we get on phone with Dr. Asim Javed because we are in the very initial steps of the stroke program, so we get advice on each and every step of the procedure. And he does a remote proctoring for us as well. This is one of the CDs which is going to be played, and you can see that the obstruction there as well. If I can pinpoint it probably, I think. And so we got this done very quickly, this from the CT department, and then we got him into the cath lab. His aspect score was 10. Patient was shifted to the cath lab because he's in-house patient, so the procedure was very quick in shifting the patient down to the cath lab. And I think like time is muscle, so time is brain as well. That's what I've learned over the time. So this is cerebral injury. If you can see on this side, because these are the few issues which you will face in the beginning, is how to put even the head stabilizer to the patient. So that's in the picture there, because we could not get it out of the picture in the beginning. So we thought that, okay, let's do it with it and just get some pictures from it. And you can see the obstruction there as well. I'm going to go quickly through this because I'm not going to go through the whole procedural aspects of it. And if you see that's his post-mechanical thrombectomy, and it was an acceptable result for us at that time, and his symptoms improved as well, and then he much improved on discharge. Now, this is the main thing is the future plan for us, because we are in the very nearby vicinity of the HMC. We do not have any neurologically dedicated service in our center, but probably in future we might take that on board as well. So our short-term plan is, as I think RIC followed as well, and in the beginning they started with the in-house service without announcing it to the outside, because then you get all the patients to you guys, and it probably will prevent them from getting the treatment which HMC might be in a better position to provide to them. And then in future, once we have got that, then medium-term goals that we will extend it beyond, and whoever shows us to the centers, and then later on probably in collaboration with the other centers, we can make a program. I think we will be in discussion very soon with our other sister institutions in order to make a program where we can work probably around the clock the service, because KP is lagging a lot in this. I've seen the NICVD and RIC and all these provinces taking a lot of patients, and I think we need to provide that service to our province as well. So I think the main thing will be, again, because you have to get the accreditation for it, which we are working and being guided by Dr. Asim Javed for that, and from RIC. We still regularly attend their workshops and things and go there and do cases with them. And we have started carotid program as well. So I think it's a baby steps, but inshallah it will get us soon to a service that will benefit our patients. And that's the PIC. So thank you so much, and hopefully inshallah we'll see you around.